Hey guys, how's it going? It's Dr. Brian Adkins with the Adkins Academy, going live on our Facebook page. Just wanted to go over our question of the week with you. Sorry, we're getting started a little bit late here. Just kind of makeshift getting some work done and kind of got a little behind. But definitely remembering you all and certainly wanted to go live and do our question of the week for all of you who have engaged with us on social media. So our Facebook page, our Twitter page, Instagram. Thank you all for certainly engaging and providing your answers on our different social media pages. Definitely appreciate your insight, appreciate your thoughts, and let's talk about the actual question here. And this video will be posted on our YouTube page, so if you just go to Google, put in the Adkins Academy YouTube channel, you'll actually see some of our previous videos that we've done to answer some of the questions of the week as well. And if there's any particular one that you want to see or any particular question you'd like for us to go over, you'd like for me to answer, I'm happy to certainly answer any of your questions. So certainly chime in either on this post or on another post, and certainly let me know what you'd like for us to answer. I'm happy to answer whatever you guys want to answer. So so we have had some clients who have asked for more clinical questions, so I wanted to give you a couple more clinical questions as well as some basic science questions. We'll get back to those as well, all right? But a lot of people want to see more clinical questions. I'm happy to do that and happy to work with you on that. Ms. Shoemake is our NCLEX instructor, or one of our NCLEX instructors, and she's been doing a great job with our NCLEX students. They've been doing very well with a lot of the NCLEX questions that we've been giving them and making for them and going through with them during the NCLEX course. And so I'm really proud of them. So thank you, Miss Angela Shoemake. She's actually a professor at a nursing school in Louisiana, and she helps us out with our NCLEX course as well, and really does a fabulous job with teaching that course. And so if you'd like to learn more about our NCLEX course and how that works, please feel free to reach out to me anytime. 301-960-4950. Happy to have a conversation with you about our program. Also, one other thing, if you want to see more questions like this, I actually just uploaded and made live and active on our website our free quiz. And so we have 3 new free quizzes, brand new questions. You haven't seen them before. I just made them up, right? And so, but they're very challenging, they're very tough, and they're very representative of what you're likely to see on, for example, the TEAS test or the HESI exam or the NCLEX exam. And so we've made several new quizzes and new questions for those quizzes. And so we have those 3 quizzes that are available on our website, so atkinsacademy.com. And if you just click on, if you go to our homepage, atkinsacademy.com, you can actually see, you can actually just click on the free quiz link there, and I'll just kind of pull it up here for you. If you go to our page, there's our homepage there, and so if you just click on that right there, that free quiz. And that way you can actually do quizzes for the TEAS test, the NCLEX exam, as well as the HESI exam. And so I provide you with some explanations within those as well, those quizzes. And so you can so if you just click on the button right here, it'll actually highlight for you and then take you to our free NCLEX and TEAS and HESI quiz. And so if you click here, you can actually start one of those quizzes. And so definitely take some time to do that. There's one of our you can kind of see there one of our free quiz questions for the TEAS test. And so if you're looking for just some content that you can really utilize to challenge your understanding of the concepts, really challenge your knowledge, really grow your knowledge, and really help you to understand how to deal with the TEAS test, how to understand the questions, how to approach those questions. Because a lot of people, I'll be quite honest with you guys, I mean, a lot of people are using the book, the books off the shelf. I don't want to name any books, but those books, right? And so the national average for the TEAS test is a 64. Right, and so a lot of these nursing schools, especially the ADN programs and the BSN programs, and a lot of these very competitive places, they want you to be in the 80s and 90s, okay, not the 60s, okay. And so if you are just using the book, and you've used the book, and you've used the book again 3, 4, 5 times to take the TEAS test or take the HESI exam or take the NCLEX exam for that matter, and you're not doing well, you're not passing the NCLEX, right? Or you're not passing the TEAS test, you're not passing the HESI exam, then why are you expecting different results and using the same book, right? Even if you use another book, a lot of people are using this book or that book, and you guys know the books. If you guys are using these books and not doing well, then how about you kind of think about your study methods and your study habits, right? And so you've made it through the prerequisites, you've made it through the general chemistry, the general biology, anatomy and physiology. So it's not that you're stupid, it's not that you're dumb, it's not that you don't know how to study, because you do, right? That's not what it is. It's not about it's really about what you study, right? And so it's not about how long you study. I always tell my clients as well, it's about what you study. If you're not studying the right stuff, if you're not understanding the concepts, you're not understanding how to apply your knowledge and how to apply the material, if you're not actually going through questions and really hundreds of questions and understanding the hows and the whys and understanding how to look at the answer choices and be able to decipher this versus that, then you're not really prepared for the test, right? And so with the books, they don't really give you that level of granularity in terms of granularity in terms of being able to explain to you exactly how this is the answer versus that. And so if you're unsatisfied with what you've been doing, and you're not getting into the 80s and 90s where most of my clients are getting, then please certainly consider our program, right? And so I've been around for several years, right? I have lots of great reviews out there. I have a client just 2 days ago got an 84 on the TEAS test, but lots of clients over the years who have gotten into the 80s and 90s and even higher. And so I can definitely help you to do the same thing. And so the way that I do that, it's not a secret. We go through literally hundreds of questions. We go through question by question by question. We talk about the correct answers. We talk about the incorrect answers. We talk about how you can understand the concepts, how you can apply your knowledge of the concepts, right? And so if you look at the reviews, people will tell you, about our course, people will tell you that, we go through, it's very detailed, right? It's not an easy kind of thing, right? But but if you understand the concepts and you're prepared to learn the concepts, you're prepared to put the concepts together. I don't tell you to just memorize, right? I hate memorization, right? So I don't tell you to just memorize. What I try and do is help you to understand how to apply your knowledge, right? And so I give you clinical scenarios. I give you research scenarios. I give you, real scenarios, real life scenarios, so that you understand. I mean, even in math, we talk about, everybody talks about that, the question with the fractions and how I use just the example of T-shirts. You're selling T-shirts, right? And so if you're selling T-shirts and you get this many boxes and this many boxes and this many boxes, how many boxes do you have in total? So we really give you these real life examples to help you to understand how to apply your knowledge and how to answer those questions when it comes to the TEAS test or the HESI or the NCLEX exam. And so, like I said, we can help you throughout the entire gamut, from getting into nursing school, as well as getting past nursing school, as well as getting through nursing school, I should say, and getting past the NCLEX exam, so you can actually start practicing and be one of our colleagues who's actually working side by side with us. But we'd love to help you to do that. And so feel free to reach out to us anytime, 301-960-4950. I'd love to talk to you. But for now, let's go ahead and get to our question of the week here. And so in terms of our question of the week, we have a tough one. Okay. All right. So a 67-year-old male patient with a long history of high blood pressure. Right. So that alone, 67, he's kind of older gentleman, high blood pressure, and so long history of high blood pressure. So he's definitely got some cardiac issues, right? And atrial fibrillation after a recent MI. So MI is myocardial infarction. That's a heart attack, right? So he's actually had a heart attack, long history of high blood pressure. These two kind of go hand in hand, right? If you overwork the heart, it's the heart's gonna let you know at some point, right? And so we talk about these things and give these types of examples, not only with our NCLEX course, but also with our TEAS course as well, so you understand it, right? And so atrial fibrillation is where the atria is literally kind of fibrillating, right? And so when the atria is not able to contract and give you a nice contraction and force the blood from the atria into the ventricles, and you get that atrial fibrillation, that means that the blood is pooling. If the blood pools, that's not a good thing, because that increases the risk of clotting. right? And so AFib can lead to clotting. So that's why you see those commercials, right? You have AFib, you need this blood thinner, that blood thinner, right? And so and so that's what they're selling, because if you have AFib, you're at increased risk of clotting, so therefore you need to take an anticoagulant. That's those commercials, right? And so we try and again help it to make sense for you. All right, let's go back to this. So your patient is going to present with painless sudden loss of vision in the left eye. So he presents with painless loss of vision, sudden loss of vision in the left eye. Okay, and so the ophthalmic artery occlusion clot, right? So you're thinking of maybe some kind of clot within the ophthalmic artery. Is occlusion is suspected and managed immediately, right? So which one of the cranial nerves would most likely, I should say, not? And so keyword there, not. And so this is what we talk about during the test. So when it comes to the test, let me just help you out with one thing here. They're not looking for your opinion. Right, so stop giving them your opinion. When we talk about the reading section, the math section, the English section, or the science section, stop giving them your opinion. And so what I mean by that is a lot of people will answer questions based on what they think, without necessarily reading the question itself. And so some people would start doing some math, right? Come up with an answer, say, "Oh, I see my answer. There it goes, right there," right? And then put that answer. But wait a minute, is that what they asked you for? Right? Because unless you are actually putting what they've asked you for, then you're not getting the question correct, right? And so when you go into these standardized exams, when you go to take the exam, again, a piece of advice, your opinion doesn't matter. Your opinion doesn't count. They didn't ask you for your opinion. They asked you for your decision. Decisions are based upon logic, right? Opinions are based upon, your judgment is based upon your opinion, right? So they're not asking for a judgment call. They're not asking for your opinion. They're asking for facts. They're asking for logic. They're asking you for to make a decision based upon the facts. And so that's what we want to stick to, right? And so with the question, one of the things that they like to do is they'll put things like not, or they'll put other terms in there that may be the opposite of what you're thinking, right? And so make sure that you look for that. So obviously read the question very carefully. Make sure that you're answering the question according to what they want. And hey, everyone, thanks for chiming in. I see a couple people chiming in and liking. Definitely appreciate that, everyone. All right, but make sure that you're putting exactly what they want you to put, right, and not what you want to put, right? So there you go. All right. So with that, which of the following is not, or would most likely not be affected? Let me turn this back around here. So not be affected by the suspected clot location. And so in terms of the answer choices here, we have the oculomotor nerve. And so that's going to control some of the motor of the eye, obviously, right? The accessory nerve, the trochlear nerve, and also the abducens nerve. And so, which one would not be affected? Well, let's take a look at some, just some basic anatomy and physiology here, right? And so, if we take a look at this, and so we just have, can we understand that the and by the way, if you've ever taken our course, or you're looking to take our course, this is how the course is. I mean, we go through questions. It's a live session, and we write on the whiteboard, right? You can see me writing on the whiteboard there, right? And so we go through and we talk about the questions one by one, and we can write on the whiteboard and jot things down. But again, the heart is here. And so with that, we have the blood coming from the left ventricle here and going into the aorta. And so when it goes into the aorta, then it goes up and up this artery here. And so that's being the carotid artery. And so here's the common carotid artery, and kind of splitting here, we have the external and the internal carotid arteries. The internal carotid artery in particular is what we're thinking about here. And so that internal carotid artery is actually going to provide, hey Evan, how's it going? Thanks for chiming in. So the internal carotid artery is actually going to provide blood flow to the optic to the eye, right? And so and so some of those nerves and some of those muscles that are going to control the movement of the eye, whether we look right or left, up or down, kind of the visual fields, those are going to be controlled by and make sure that by the way, the cranial nerves, right? Those are going to be controlled by cranial nerve number 3, 4, and 5. I mean 3, 4, and 6. Sorry, 3, 4, and 6. Okay, and so let's go. I just wanted to pull up the cranial nerves chart here with you. But let's let's talk about that. So definitely make sure that you know the cranial nerves, right? And so in order to understand this question, not only for the TEAS test or for the HESI exam, you definitely want to know and understand this chart here. And so this slide here, and that is the cranial nerves. And so in terms of the cranial nerves that control the movement of the eye, so the movement of the eye will be controlled by cranial nerve number 3, 4, and 6 here. So 3, 4, and 6. And so what we're talking about is the abducens nerve, the trochlear nerve, and also the ocular motor nerve. The optic nerve is cranial nerve number 2, and so that's going to control vision to the eye, and so that's going to control the kind of the retina here, and the and certainly the the visual fields. Okay, and so being able to actually see the the act of actually seeing, and that signal being transmitted to the occipital part of the brain, which is where you have that visual cortex. Okay, and so definitely important to understand that in order to understand what's going on with your patient. And so with this, your patient has a situation in which he's got loss of vision, maybe inability to move the eye potentially. And so you want to kind of certainly drill out those two things also. Is it just loss of vision, or is it loss of vision and movement of the eye? But which of the following arteries is probably not affected here? Well, we also have to understand that other option. So we had 4 answer choices, right? So in terms of our 4 answer choices, we had the accessory nerve as the other option here. And so let's just turn this back around. And so in terms of the accessory nerve is cranial nerve number 11, right? So cranial nerve number 11, right? So again, you want to make sure that you know the 12 cranial nerves. And so cranial nerve number 11 here is the one that is going to control the muscles of the neck and the back, so the trapezius muscle. And so when you ask your patient to shrug their shoulders, and so when they shrug their let me just kind of do a kind of clinical visual here. When you ask your patient to shrug your shoulders up, and you kind of have your hands on their shoulder and you're pressing against their shoulder as they shrug their shoulders up, that's an indication that cranial nerve number 11 is actually working, right? And so the accessory nerve is the one that controls that particular function. Okay, whereas movement of the eyes, when you do a visual field test for your patient, and so look left, look right, up, down, right, moving your finger around your patient is able to follow your finger, that is an indication that the cranial nerve number 3, 4, and 6 actually works. Okay, and so not just visual acuity, but also visual motor. So kind of motor to the eye. And so those are the things that you want to certainly look at. But certainly the accessory nerve is not going to be associated with the optic and the orbit, and certainly the optic canal there with the eye. And so cranial nerve number 2, 3, 4, and 6 there. And so with that, we're talking about the accessory nerve here, right? So I know a long way of getting there, but hopefully this has been helpful in terms of giving you some A&P, just a little bit of A&P here, and obviously kind of putting it all together, and which cranial nerves are involved in movement of the eye, but also vision. Which arteries are we talking about in terms of the internal carotid artery, and then branches of the internal carotid artery, which is the ophthalmic artery going to the eye. Oh, sorry about that there. Not sure what happened there. And so if the ophthalmic artery is occluded, then that can certainly obviously cause an inability to see, but also inability to move the eye, depending on the extent of actual occlusion and lack of blood flow. And so we also do other videos, and we talk about the whole premise behind blood flow, and making sure that you understand the ABCs of emergency medicine, or ABCs of medicine in general, which is airway, breathing, and circulation. And so in order to make sure that all of your cells and all of your muscles and all of your tissues are actually working, they need to be perfused, right? And so part of that perfusion has to be that they get blood supply. And if you're not getting blood supply, the tissue cannot work, right? And so the tissue needs ATP. If you don't know what I'm talking about, definitely consider taking our course. ATP is the energy currency of the cell. In order for the muscles to move, in order for the eye to work, you need those muscles, those cells, they need ATP. They need energy, right? And so if you want to maintain, your mortgage, your rent, your car note, your cell phone, right? You need money, right? And that's the way that this system system works, right? So and so you need to generate money in order to pay your bills, right? Well, the same thing with the cell. You need to generate ATP in order to have that particular cell or that particular muscle cell continue to function. And if you can't make ATP because you can't get oxygen delivery, you can't get glucose and nutrient delivery to those particular cells and those particular tissues, then those tissues will fail. And if those tissues fail, then certainly you'll see that on the pathophysiology side there, right? And so you'll see that your patient has loss of vision or loss of movement of the eye if the ophthalmic artery, the blood flow to the eye, is occluded. Okay. All right. So hopefully that puts it all together for you. I know it was a tough question, but I wanted to kind of give you some aspects of physiology and pathophysiology and anatomy, so you can put it all together. I know it's a complex topic, but still, hopefully we made it easy enough for you to understand. And so, like I said, during our class, we go through diagrams and pictures and help you to put A with B, B with C, and C with D, and making sure that you see the flow of information, but also you're able to eliminate answer choices and come up with the correct answer. All right. So thanks for definitely chiming in. Thanks for joining us today. We'll have our next question of the week on next week, Monday. If you've missed any of our questions of the week previously, please definitely take a look at our YouTube page. So Adkins Academy YouTube channel. And so also definitely take a look at our quiz, our free quizzes. Let me know what you think about the free quiz. I just put those up, in fact, over the weekend. And so let me know what you think about those quizzes. So there's a free TEAS quiz, a free HESI quiz, and also a free NCLEX quiz. And so if you really want to challenge your knowledge of the concepts and see several different quizzes and engage with us, then certainly go to our website, atkinsacademy.com, and then just click on the free quiz button there right on the homepage. Okay. And if you would like to speak with me directly, feel free to reach out to me anytime. 301-960-4950. In the post, you can certainly see our phone number there as well. And so definitely reach out to us anytime, give us a call, and happy to speak with you directly. And also, like I said, if you just had any particular questions that you'd like for us to talk about during our question of the week or go over during our question of the week, then certainly reach out to us, and we're happy to put one of your questions up as well, right? Or at least generate a question around your particular topic of interest, and we can talk about it together. All right. And so until next time, we'll definitely see you. Definitely have a good rest of your week, and hopefully everyone had a great Easter and a great weekend. And we'll see you for the next one next week, Monday. But certainly tune in, like us on Facebook or Twitter or Instagram, but also on YouTube, because I do other videos throughout the week. And so if I do another video, you'll get a notification of me doing a video. All right. So we'll see you next time. Thanks.